think we don't need to introduce Jeff to this crowd. He's one of our co-PIs. But it's really nice to have Jeff talk about the work. He's given some amazing talks in the last few years. So looking forward to this one as well, Jeff.
Thanks, Manav. So today I'm going to talk about quarantine and testing strategies to ameliorate transmission due to travel during a pandemic. I'll briefly mention what Manav and I were just talking about, some of the work on quarantine that affected CDC decision-making. What I want to do is try to, in this talk, differentiate and point out that basically that I think that the public health community has sort of thought of quarantine with regard to a particular disease as a particular thing that you might know, oh, this would be an appropriate amount to quarantine for this disease kind of thing. But I think actually quarantine is not that kind of thing. Quarantine, you do a certain amount of quarantine in order to accomplish a certain goal. And you need to think about that goal in order to figure out what you want to do as a quarantine. It's not like there's a single goal of quarantine, which is sort of how we sort of often conceptualize it. If there were a single goal of quarantine, it would be sort of what people have traditionally thought about it, like preventing any opportunity for someone who is or might be who might be infected in terms of quarantine as opposed to isolation. So anyone who might be infected from possibly passing on disease. But even in practice, it's usually not designed to prevent every and all disease transmission, but just most. And so as soon as you start realizing that it's a probabilistic measure, you start realizing there's lots of different ways that you can use quarantine, and actually has been used in a lot of different ways. But unfortunately, I think in many cases it's been applied with this very uniform idea that the whole point of quarantine is to absolutely and completely prevent transmission. And that eliminates actually many potential uses of it as a disease transmission blockage tool that don't have quite as drastic effects on the livelihoods of individuals who are subject to quarantine, and also makes it impossible to have less draconian measures of quarantine used in cases where things are lower risk. So it doesn't do us, even as public health people who really want to help the public health, it doesn't necessarily help because it eliminates strategies that we could apply that would prevent, as well as providing really, really strict policies. So in particular, let me just give my disclosures. I have done consulting for BHP, BP, and EasyJet, and some of it regards quarantine, so there is relevant disclosures to make. So this is just a picture from, I think, the 1800s in France about cholera quarantine, just depicting cholera quarantine officials preventing entry to France during a cholera epidemic. And it's just to emphasize the point that this is a long-standing policy, one of sort of the longest public health policies that has ever existed, one of the oldest tools in the book, so to speak. Back in the 1400s in Venice, quarantine was a 40-day operation, which was done on ships that came in from foreign ports, hoping to prevent any disease transmission into the country. And again, the design there was to prevent a disease that they didn't feel was in their country at all from entering their country, which is maybe where you have the strongest motivation for really draconian quarantines, because complete prevention of it even entering the country can result in a lot of public health benefit. And you're willing to put those travelers through a considerable amount of quarantine and difficulty themselves in order to prevent transmission at all from happening within a country. And indeed, early in the COVID-19 pandemic, which is what these images are about, and in any pandemic, the travel restrictions are generally aimed to slow or mitigate the spread of disease to heretofore unafflicted patients. That is, the new zoonotic disease usually enters in some locale, and then early on, the idea is if we can put sufficient quarantines and travel border restrictions in place to prevent the disease from spreading into our country, then possibly it can be taken care of in that local area, or alternatively, we can be given some time to adapt and ready ourselves for the epidemic as it approaches. Obviously, the longer we can put it off, the better. And during the early pandemic spread, travel restrictions can do some definite benefit in slowing or mitigating the spread of disease. This is just an analysis by Linka et al. Of different countries and the degree to which they were able to prevent or delay disease when they had zero prevalence and the issue was incoming disease spreading within their country. But I just want to comment that especially during this COVID-19 pandemic, there were some very strict national border control measures mandating extensive quarantines that were often imposed between origin and destination countries when there was actually ongoing transmission in both countries, which is a very different situation from a situation where you have transmission in one country and zero or very, very low levels that can be handled by case tracing and quarantines operations. When you have ongoing community transmission, then it's sort of a very different question. So is it really reasonable, is the question I want to ask in today's talk, to install a very, very strict border quarantine or even a border control where you're not allowed to move from country to country when you have motion from one country to another and from one country to another, and perhaps you have slightly different prevalences in the two countries, but or even large differences in prevalence, but you have community transmission in both. When is it justified to do that? And I'll come up with I wouldn't say an assumption, but a statement of at least one value you might impose about why you'd make a decision with regard to this. And then I'll do the mathematics right here and show you what comes out as a consequence of that. So I'll just comment that one of the reasons I think they get so much attention is that they're a very politically expedient executive action. That is, they're usually something that an executive, president, or leader of a country, it's usually within their realm of power as opposed to the legislative branch to impose these border restrictions. So it's something they can do very quickly to look like they're acting in defense of the public health. And indeed, they may well be, but there are some questions as to how much public health benefits they confer, and it obviously depends on the dynamics of the particular disease. But in the case of COVID-19, one analysis from 2020 in Science said that there was sort of diminishing and not very great public health benefits to a lot of the border controls that were imposed. Imported cases, little impact where community transmission was well established is one point. The point on the figure on the left, I just want to set aside for a moment because that's not my point. The point on the left, it was that there was a lot of transmission from Wuhan that was stopped when there was a Wuhan travel ban, but because transmission had already happened to other places, there was continued transmission. And so it wasn't really clear. This analysis was pointing out that putting together a travel ban from Wuhan was not particularly useful. That is a very important point, but it's not the point that I'm going to get at today, which is that once you already have transmission in a country, very quickly the amount of transmission within a country swamps the amount of disease import that you can accomplish by travelers, because most individuals in a country are not traveling. So we need to really quantify those sorts of different risks if we want to come up with a really appropriate way to think about travel quarantine in the context of pandemics. The WHO relatively early on in this pandemic, recommended a 14-day quarantine of COVID-19 to exposed individuals, that is, individuals who've been exposed to disease. And one of the points I want to emphasize is that that is actually a particular case of someone being exposed or being at high risk. Very often that same quarantine is then imposed as a border quarantine for someone traveling from another country where there is some transmission, arbitrarily high amount of transmission within that country. That's actually a very different case from an individual who is known to be exposed. That's an individual who you have no known exposure to. You just know that there is some disease in that other country. And so imposing the same 14-day quarantine on those individuals may not be appropriate. Not long after that, the WHO declared that testing became a possibility. And actually, one of the things that we pointed out early on was that with testing especially on exit from a quarantine, you can dramatically decrease the probability of post-quarantine transmission for shorter durations of quarantine. So that is, adding a test into the mix gives you equivalent to a 14-day quarantine prevention of disease transmission with a 6 or 7 day quarantine, just if you add that test at the end of your quarantine. Adding a test on entry does a little bit of benefit for you in addition to that, but not much. So generally speaking, we want to test at the end of quarantine, and we can have a much shorter quarantine if we do a test at the end to ensure that there's not going to be ongoing transmission. And this was based on I'm not going to go through it here and now, but some fairly complicated mathematical modeling that we had to do, just double integral kind of like calculating the amount of transmission over a period of time, given the uncertainty of when the person was infected, mathematics that allowed us to do this. And that mathematics plays into the work I'm going to talk about today, which is why I'm just mentioning it right now in a way that I'll come back to. So these rapid and accurate analyses do in fact beneficially affect policy. This paper that was published in January of 2021, but we released it as a bioRxiv paper in October. And that research was cited by the US CDC in changing the quarantine policy, and also was brought into consideration by the ECDC, European CDC, in their decision-making with regard to quarantine and testing in Europe. The results were also validated by two papers that were published subsequent to ours, independent teams using distinct methods, Quilty et al. And Ashcroft et al. So the question becoming, as I've sort of pointed out a couple times here, when is it reasonable for travelers who haven't been identified as likely to be infected in any particular way to endure some extensive quarantine when disease is present on both sides of the border? And how does that relate to this guidance from the World Health Organization that maybe we should have a 14-day quarantine for individuals who are thought to be exposed, have a high probability of coming down with disease? Now, I just want to set aside one thing before I answer that question, which is oftentimes travel quarantines are confused by concern over travel itself as a transmission risk, and there certainly are some risks associated with travel. Particularly buses actually are a very high risk because the air circulation, if the windows are not open in buses, tends to be quite bad. But I just want to point out that for international air travel at least, and for national air travel in most nations, administrative control over both the air handling and over preventive behaviors of passengers has been high, and in-flight transmission has been low. Now, just recently, mask mandates were removed, and I don't want to comment about what that's going to do to transmission in airplanes. So I urge everyone to think carefully about that issue, because this comment is restricted to when we have masks as well as the good air handling. But certainly the air handling in airplanes is quite good and does help to mitigate transmission during air travel. And so I'm not assuming that there's any particular transmission in addition just because of the travel itself in any of the work that I'm doing here. Although in some circumstances, if you're traveling by bus especially, that might be a legitimate concern that would have to be included in the kinds of calculations that you're doing. So how can we calculate this? And I'm just going to assert that the effect of travel policy on in-country transmission essentially comes down to an import-export balance. Essentially, we're just worried about how many infections we're transporting to a country we're going to, and how many infections we're bringing back from that country, and doing sort of an accounting of all of that motion. And in this little diagram, as I've drawn it here, I've just schematic country A and country B are both circles. And the dots here do not represent infected people, but infections that are happening. So in other words, these are new infections that are happening at a snapshot in time. And the point being that what we want to avoid happening is travelers from A in B causing new infections, leading to new infections from there going in there. And then we also want to prevent new infections from coming back to us in our country A. And all of the mathematics I'm going to show you now is oriented towards maintaining the level of the infection rate within a country to be constant despite travel. That's sort of the basic idea here. What we want to try to do, it seems to me, with border controls is prevent travel from adding any additional infection compared to what we'd get if we had no travel. Because the fact is, even with no travel, once you have community transmission, you have infection. So what you want to make sure you do in terms of travel is that you don't add to the burden in your country on the basis of travel that's happening. So in order to do that, you first need to sort of quantify how much transmission is happening in your country. And this is just a mathematical statement of that, where N sub A is the amount of individuals who are staying in A, not the travelers, times the incidence in country A. Incidence meaning how many people are infected on a given day, are getting infected on it, times the RE sub A here, which gets really complicated. That's for mathematical reasons I'm not going to go into, but basically that's just the RE, the effective rate of transmission of a case. How many cases do they cause in country A? And then this is just a quantity to characterize the amount of immunity in A. So it could be vaccination or unwaned vaccination, as the case may be. So if you multiply that out, that's the amount of transmission that's happening, and you can put the right unit there so that it's any time period you want. We did it in days just for convenience, but so the amount of transmission that's happening in the country on a day-by-day basis. You can then also characterize, of course, how much the folks are traveling. So NAB is just the number of individuals traveling to another country. Rho here is the prevalence in country A. The prevalence, in other words, that tells us what fraction of those people traveling are actually carrying disease to country B. And then R sub V, which is the variant specific amount of transmission that they're causing. This R is also variant specific, but it's notated differently. And then also we need to acknowledge for what this transmission is going to be, what the level of immunity is in the country. So then you can do that for both A and B, and you can do it for going both directions. And then further, you can characterize the transmission of travelers from B in A. There's a bunch of bookkeeping here, but basically what you can come up with in the end is a sufficient travel quarantine duration inequality, which says we can ensure that travel is not causing more infection than what would be there if we blocked travel entirely, as long as this quantity, the amount of transmission that's just going on within the country, if the total population stay within the country, as long as that's greater than the amount of transmission in country A due to all of these travel dynamics that I've just mapped out for you. So there's a way to just quantify all of this. And this mathematics looks complicated because it's a big formula, but it's actually just a bunch of addition and multiplication. It's not complicated. The only part that is complicated is actually these R's that have subscripts with Q's in them. RQ of A is actually the amount of transmission given a certain quarantine that is imposed in country A for travelers coming into country A. That actually gets mathematically quite complicated, and I'm not showing you how to do that, but that maps back to that original paper we did on quarantine and transmission that was cited by the CDC. So it's not mathematics that's actually new to this paper. It's just a little bit complicated. So I'm not going to show it here. We define sufficient travel strategies as those that do not elevate a country's case burden when travel is permitted with another country, and then you can specify what the quarantine and testing regime was. In this case, we always assumed testing on exit because that was available at the time of the study. And so the question is, what travel quarantine would we expect with a test on exit for different countries? And I've just shown you a bunch of diagrams for Europe, which is where we use data to model this particular scenario, where there were some very extensive quarantines between countries that each had high transmission in many cases. Of course, this changes over time, so it needs to be a policy that's modulatable, because some countries end up with high levels of transmission 1 month, and then 3 months later, those situations may well be reversed. In these diagrams, what I've done is I've put in a red or dark red color the country of interest that we're talking about. So we're talking about Spain here as the country A. And the question is, what other countries do we want to just allow travel to or have different amounts of travel to? And the point is, you wouldn't get any more transmission in Spain, basically, if you imposed the quarantine that's indicated by the color in these other countries. So for instance, from France, given the level of infection in France and Spain, you don't need any quarantine at all, just a test. And then you'll get less transmission by having travel than by not having travel. The UK at this time had high transmission, and so a much longer quarantine is needed there. And Italy did not have so high transmission, so a very short 1 or 2 day quarantine would be sufficient, et cetera, et cetera. And we can look at this both for large European countries like Spain, but also smaller ones. Here's Malta. One of the interesting effects of doing this mathematics is it actually shows you that actually the population of the country matters a lot. Like if you're concerned about protecting a small population like Malta from transmission due to travel, small countries like Malta have a lot of travel because they're popular tourist destinations. And so it's actually much harder, and the quarantines tend to be much bigger for those countries that are highly economically dependent on travel. So there are definitely some conflicts of interest between the economics and the public health. But if you wish to prevent the travel from actually causing a significant disease in your population, then you do need to have fairly high quarantines for these smaller countries like Malta and Cyprus as well. You can go through these examples and look at each one. So it goes from different extremes. Countries like here we have Austria and Hungary, which had fairly high transmission in their own country. There's not really a reason for them to actually impose any sort of quarantine for the most part. Hungary certainly at this time had very high transmission. When you have higher transmission than all your neighbors, you're basically net exporting disease whenever you allow travel and importing people who aren't diseased. So it's actually a benefit to you to have travel. It doesn't make sense to have a border control from a national perspective. Obviously, from a European perspective, it makes a difference. And all of this can then be incorporated into a European-wide analysis. In fact, the coloration here of dark red, light red, et cetera, was the European traffic light system, which they had, which was a EU-wide way of deciding what border controls they should have between countries. And we showed in this paper, although I'm not going to talk about it today because it's very specific to the EU, how to map this more specific analysis to their traffic light system so that you could basically do that kind of operational decision making on a policy basis that was a little less sophisticated than what we offered from this model-based analysis. Now, that's, was just showing you a couple maps, but you can do this for all of the countries for which we could get accurate travel data, basically, and show what the respective quarantines should be. And I just want you to notice how much of this chart is filled with zeros. So there's a tremendous amount of travel that could be allowed that does not actually increase the amount of transmission that's going on. And obviously it has very high economic costs and a cost to personal liberty of individuals who want to visit family, et cetera, to impose these quarantines. So there is a significant amount of ability to relax some standards that would not cause greater disease. On the other hand, there are some countries for which longer quarantines are necessary, and they're indicated by these darker purple squares for individuals. So in this case, on the y-axis is the destination country, and on the x-axis is the origin country. So countries like Cyprus, as I mentioned before, that are small, tended to have pretty high quarantines necessary if you didn't want to increase the amount of transmission in your country due to travel. And countries like Hungary, which had at that time very, very high levels of transmission, they don't need any imposition of quarantine, at least from their national perspective. So you can get quantitative results for all of these. I just want to point out that, of course, during the time that this was done, which is in November, we had basically 3 different variants. We had original strains, we had Delta strains, and we had the beginning of Omicron coming through. And so there was a lot of complex variant-based questions about how to do this. And the point is that the mathematics actually remains the same for different variants. Like if you are concerned about Omicron specifically, and you don't no longer concerned about the original Wuhan strain or the Delta strain, you can just do it for Omicron. And as long as you have some sort of ideas of the prevalence of the different variants, you can do that calculation. Or if you're concerned about Omicron and Delta, you can do it on the basis of Omicron and Delta. And there's various ways of doing that. Here, it just shows you for a smaller subset of countries what it would look like if you were just concerned about the Delta variant or just concerned about the Omicron variant, concerned about all except the Delta and Alpha variant down here, or concerned about general transmission and Delta and Omicron. In other words, you want to prevent higher general transmission, want to prevent higher Delta transmission and higher Omicron transmission. Of course, just because of the way population genetics works, the more different constraints of not increasing a certain variant in your country you want to set, the more drastic the quarantines end up starting to become. Because of course, any disease, there's going to be population variation between countries, and that population variation, every bit of variation, if you try to stop it from coming in, is going to increase your quarantines. But even in the case that we're looking at this general transmission Delta Omicron situation, we still have quite a few zeros in our maps of what level of travel border control is necessary in order to prevent additional infection within our country in response to the pandemic. Okay, so that's basically the results. I just want to share, though, that in addition to coming up with the modeling and doing all the work ourselves, it does require this complex mathematics I mentioned, especially with regard to the quarantine and what the respective transmission with a given quarantine policy is. However, it's possible, we figured out to use a pre-calculated lookup table approach so that we could populate a simple Excel sheet calculator that would be usable by public health professionals, where they just plug in the relevant data for their countries and gives a high precision, sufficient quarantine with testing for any country pair. And we tested this against our very detailed model, and it's almost exactly on the money every time. So it's just as good for the purposes of policy determination and is fairly straightforward to use. And so I think that's an important part of what we need to do as researchers working on public health, is make these things accessible and usable by people. And hopefully this is something that will come in useful as the COVID-19 epidemic proceeds, but also in future times when we're looking at epidemics that are spreading around the world. I just want to make one comment about the kind of result that you get from this, which is just to emphasize that although we wrote this and did all this work to try to talk about the particular situation of community transmission on both sides, what kind of quarantine should you use, it actually works perfectly well throughout the pandemic, right? So early on, when you have very big differences where you have zero in one country and high transmission in another, it will say you need a very strict quarantine. So it gives you the result that you anticipate, and it only modulates as that situation alleviates over time or changes over time, where you then have transmission on both sides. So it's basically a universal tool for figuring out what kind of quarantine you would want to impose during a pandemic at whatever stage that pandemic is. And the later the stage, it also continues to work and continues to work. So that is something that I think is important to emphasize, that it's not just for the late stage, it works at the beginning as well. And then I just wanted to emphasize that the travel policies have sometimes seemed draconian, and just reemphasize this point that in public health decision-making, I think a lot of public health folks were somewhat paralyzed as the pandemic went on in trying to figure out what to say about these sorts of quarantines that were imposed. You saw a lot of going back and forth between very strong quarantines or zero quarantines, like when do we drop the really strong quarantines in favor of having no quarantine whatsoever? And I think that very discrete thinking is harmful to our ability to actually maintain control over a pandemic, which of course comes in waves, et cetera, et cetera. We really need to modulate quantitatively in response to the kinds of threats that we have. And in particular, those sometimes seeming draconian travel policies, so sometimes abrupt shifts in travel policy were, I think part of the reason was, of course, public health individuals didn't have a way to say what the appropriate quarantine was. There was only reference to basically WHO, we need 14 days, or if you do a test, you need 6 days and a test. Well, these quarantines can be used in more quantitative ways than that. And this policy gives a clear recommendation on quarantines that don't completely stop transmission, but do prevent travel from increasing net in-country transmission. And that problem is now solved. So ideally, in the future, public health practitioners and researchers who are talking to public health practitioners and researchers and public health practitioners who are talking to the media can say, we do know what we should do in the case of late pandemic transmission in terms of what kinds of quarantines should be imposed. And there is a route towards acknowledging the fact that we have transmission both in country and out of country, but that we also want to prevent travel from being a problem in our country. And I'll just point out that this problem is not over. There are a few countries that are still trying to manage the pandemic in terms of border controls. You know, most of the sort of Western countries have dropped border controls for the large part, but China is still working very hard to maintain a zero COVID policy and having a lot of trouble with it. And a lot of the media is reporting about how they don't have a route out of that policy. And I think one route is to adopt a policy such as this, where you can say, well, look, we'll admit some travel from location to location or from China to other locations, but we'll make sure that travel doesn't add to our problem. And the fact is that you can do that without imposing extremely draconian measures. With that, I just want to say my acknowledgments. Basically, everything I talked about today is in this paper that was published in the Lancet Regional Health Europe. And the main authors really were Chad Wells and Abhishek Pandey and myself. I was responsible for the design and developing the theory and, sort of thinking up the whole setup of everything. When it came to actually implementing it, Chad and Abhishek both played very important roles. Chad largely implemented most of the computational structure. Both of them helped flesh out some bits of the theory that weren't complete. And then other authors contributed at various stages with just conceptualization, or a lot of them contributed to the later writing or some of the data gathering that was involved. And I really want to thank Chad in particular and Abhishek also, because they've been fantastic collaborators throughout this pandemic. It's been really wonderful to work with them on a variety of quarantine and testing problems, and it's been a really productive collaboration. So that's the story behind it. And I guess I don't have more to say, but I would love to answer any questions that anyone has.
Great. Thanks so much. Great talk as usual, Jeff.
Hi, Jeff. Very nice talk. Really enjoyed it. Love to read the papers and follow. One question about the setup. So let's say you have countries A, B, C. Are you making these decisions A to B separately from B to C? Potentially there are network effects. There might be like A to B to C and so on, right? So do you consider both? Or?
Yes, you're absolutely right. And we are doing it that way. I guess I have sort of two excuses for that. One excuse for that is that when you look at travel manifests, the large majority of travel actually is just going from A to B. I mean, we do think about these large jaunts, et cetera, but the majority of travelers are going from one country to another and then back again. Not just the majority, but the vast majority. So I think as academics, we're used to doing a little bit more of this sort of travel hopping, but a lot of businesses just go over there, do that, come back, go over there, do that.
No, what I meant is, so the travel might be just a point to point,
Yeah.
The risk of spread, they could be from A to B to C. So there is A to B, there's some spread, and then there is community spread, and then going to C. Is that?
Oh, well, right. So I guess the way I would respond to that is the parameterization for this model is not kind of how we usually do SIR kind of models, right? Where you're saying, oh, we're going to predict what's going on off into the distance, right?
Yeah.
This is a next generation model. It's like, where are we now? How much do we expect to come from the individuals we have sick right now, right? So it's a very short time scale that we're talking about modeling in this kind of mathematics. And so we don't really have to worry about A to B to C, because if it spreads in B because of what's happening in A, we'll measure that in B and then we'll be able to use it here. Now, one thing I guess I should make clear is that it does require that we have some sort of surveillance and measurement, right? If we don't know how many individuals are infected in countries, we can't do this mathematics and tell us what we should do. But we have had now a year and a half, 2 years or more, where we really basically do know that kind of information for countries. And you don't need a huge sample to get basic estimates of most of the properties we need for these countries. So because of the short timescale the math is using, because we're just using measurements of the prevalence and of the incidence, literal measurements, not model and imputed things, I don't think I'm at all concerned about that A to B to C issue, because we're measuring B and we're measuring C. And so if A is affecting B, we'll see it in the measurements that we're taking on a weekly basis that tell us what the prevalence of different variants are in each country.
Okay, thanks.
So I have two questions. The first question is, and it sort of relates to what Anil said, but maybe I'll make a little more challenging issue for you, Jeff. And I think it's an interesting thing to study. Instead of looking at it as a country, but thinking about them as arriving at specific cities in the country. One way to do that would have been to just break it down into cities and work with it. But the problem is now you have this percolation effect. You typically don't have strong border controls within a country, but stronger border control across the countries. The point being, how do you model where you have very strict controls, but a diffusive part on the other side? And there it might matter whether it comes in a small village in Virginia, which doesn't happen, of course, but let's say somebody comes on boat to some small place versus coming into New York City or Los Angeles or San Francisco, because there the effects of the kind Anil talked about come up. So that's one question. Second is, and I'm sure Srini will ask, but he should ask after this, is, we are actually thinking about a small variation on this problem, where we think not just quarantine, but we want to take into account vaccine effects and immune waning as well into the system. Have you thought about both? So maybe I'll let you answer and then I'll pass it to Srini.
Those are, as usual, extremely astute questions. But with regard to the first one, you said basically what my response is in your question, which is, so the first thing I just want to make clear is that the mathematics we've come up with, there's nothing magical about a country. You can apply this to cities, you can apply this to neighborhoods, whatever you want. The only thing is, exactly as you said, countries have the infrastructure to have border control, whereas these other institutions, other levels of government, et cetera, or levels of population don't typically have that. Except if you go all the way down to the level of a household, right, where you do tend to have control over that again. And one of the things that at one point while I was doing this modeling, I was like, oh, what does this say about my household? It says I should stay at home and never leave because we have zero transmission in our household right now, which I think we're all quite familiar with that particular decision-making process at this time. But it does say that, that's exactly what it would tell you. So what that means is just that, exactly as you said, if you're a policymaker and you want to know what kind of thing would we want to impose here, you can figure it out if you could impose it. What that means for decision making in the cases where you have these more diffusive processes, I'm not sure what it means, but you could at least tell, what you would basically want to achieve from this kind of mathematics. And then maybe with, the kind of computational approaches that you work on, you could, achieve that goal with knowledge of what that diffusive process is, how much that is allaying the benefit that you can obtain using different policies. So in particular, you're thinking about vaccination, which is which maybe you can control in some ways more than quarantines within a country, right? Or at least where you can say, okay, we're achieving this much in this place and not that much in some other place, and maybe come up with some sort of statements about what the effect of vaccination in one place on another place is, or something like that. As an aside, as you know, I think I gave this, the last talk I gave was about the waning of natural immunity following infection, actually. We have results now for all the different vaccines that have been used in the US, and also the Oxford AstraZeneca vaccine, which has been well studied, for what the presumed waning times and probabilities of infection are. That work is in revision right now, but I'd be happy to share it with you if it's of interest to you. And so that gives you these kinds of very clear statements about how much transmission you might expect from an individual who's been vaccinated based on the level of antibodies that they have over time, or that they typically have. Of course, it's always working with typical cases, not aberrant cases where people are immunocompromised or elderly or that kind of thing.
Cool. Yeah. And let Srini elaborate on the second part.
Yeah.
Both Madhav's and Anil's comments have made my questions into comments, kind of. But this was really interesting because I especially like this idea of approaching it as an inequality where an external infection or like force of infection does not overwhelm what is already happening inside. But have you thought about it in the notion of deterrence, in the sense that like you can still try to delay it, like instead of just comparing it in terms of force of infection moment? I think you kind of answered it to Anil, like it's like a next generation approach, but maybe there is a role for like simulation in the loop where you can actually project it slightly forward and see what the effects of even a milder version of the quarantine would be. Because instead of a longer quarantine, like a milder version would help delay the onslaught of that infection if the country especially needs to prepare in terms of boosters and other aspects.
Yeah, so I would say basically the way it's set up is to perfectly delay, in the sense that what it's set up to do is to say, okay, you will not get any more transmission in your country because of travel. So if you have none in your country, you will get none if you follow this procedure. I mean, that's the model. Like in reality, you never actually manage to do exactly that, but that's what the model is set up to help you do. But yeah, I guess your question is more about the forward projection. Like, what do we expect a week from now, a month from now?
For instance, like if, as the example that you gave with the household, like if the country's internal infection rate is say 1% or something like that, and then you're comparing it against 1% in terms of coming in, like just numerically. But if it was 5%, then like if it doubles, like the rate at which it will grow will be faster, right? In some sense, even if the infection rate is high locally, by allowing for more travelers coming in, you're maybe a long-term projection, or at least like instead of just the next generation approach, might allow us to see whether add more of that influx would change things.
Yeah, I mean, generally what I'd say is that, if you impose the policies as recommended from this methodology, then all of your modeling can just be working on the basis of your internal country, and you don't have to worry about the rest of the world, right? Because essentially what this policy is doing is stopping that transmission from having any effect, or at least preventing it from having any negative effect. Obviously, you can have a benefit if you let people in who are not infected and export ones that are infected. And so there is some benefit there. So yeah, you could, and the mathematics is all transparent. So yeah, I mean, you could use this to figure out what the benefits and costs are. The one thing that I'll mention is that in the process of doing this, we did often look at like, what is the relative transmission caused by travelers versus people in the country? And it's the amount of transmission in countries once a disease like COVID-19 is in the country, it dwarfs what's happening from travelers. The travelers are really not affecting our hospitalization rates or anything whatsoever once we have widespread community transmission. It just is not a factor that is even really worth keeping track of at that point. It is worth keeping track of for the sake of there's a new variant coming in and we're not going to have immune resistance to this new variant. So I'm not saying it's not something we have to pay attention to. We do have to pay attention to it, but once something has spread, it's really not an effective way to think about it. And the general point that I would make is that what you're essentially doing when you impose really draconian borders, when you don't need it because there's transmission on both sides, is trying to eke out benefit off of travelers. And you're just getting a tiny bit of benefit for the amount of pain you're imposing, right? Because you could obviously, if you did that by case finding, if you imposed isolation after case finding, you would get an enormous benefit compared to the benefit you get out of putting travelers in quarantine. So you're really doing very inefficient public health, essentially, when you do that. Now, it's true you have the infrastructure at the borders, so maybe there's some cost savings because you have that infrastructure, but even considering that, I think the costs of handling all of these travelers as if they're all infected when they're not, when typically they're not, is really, really high when you have these high transmission levels on both sides of the border. It's really, really inefficient public health, and it's not how we should be spending our time and energy in preventing transmission.
So these are assuming negative test on departure and like vaccination status, or without that, just to understand.
It was assuming vaccination level. So we had country A, country B vaccination level was one of the things that we had in the model. And vaccination level in this context, at the time we started this, it wasn't as clear what the waning rates were, but it is the unwaned vaccination level, so to speak.
No, like my question was like for the travel, like some countries, they no longer have like quarantine or travel restrictions, but more in terms of vaccination requirements or negative test on departure.
Yeah.
So does this assume that, or will the results change?
It did presume that we had a negative test associated with travel. For our purposes, at the timescale of this modeling, it doesn't matter whether it's departure or arrival, because at least under our assumptions, transmission, we were mostly dealing with air travel is how we quantified it for the most part, and air travel under the, as I mentioned in the talk, under the kinds of controls that were present in Europe, which was that you had to be masked and that you had the high airflow in airplanes. The amount of transmission due to travel during travel was actually fairly low. It's safer than meeting in a room for sure with other people. So really the problem is, you go on business, you travel, you meet in some meeting room. That's where the transmission typically would occur, not in airplanes. And that's been documented by a lot of other papers, not ours. So we weren't concerned about where the test was happening, but yes, we assumed that a test happened at the time of travel. That was part of what our quarantine analysis was, but that's easily like toggleable in that Excel spreadsheet or in our analysis. You can either include it or not include it, and the result can be given one way or another. So the next time we have a zoonosis and we don't have some sort of test yet, you can still use this on it. You just wouldn't impose that test as one of the reduction mechanisms.
I'll quickly pass it on to Anil. One thought I had on what Anil was mentioning, like in terms of A to B versus A to C, especially B and C are neighboring countries. There might be some kind of post-processing on the rules that we apply in terms of ensuring consistency. Like if you allow for travel from country B and then country C is adjacent to it with a lot of connection to country B, then you might have like inconsistent policies, and also like there is a temporal smoothing and then a spatial smoothing that might allow for more consistent policies. Else it might keep toggling between like allowing travel from country X and for 2 days and then suddenly switching to country Y. So just a quick thought.
Yeah, that's absolutely true. And certainly, if I was in one country and I knew there was a big quarantine if I traveled directly, but if I traveled through this other country, then maybe I could get away with it. And I might engineer a way to do that, and that might get around it. But I'll just comment that essentially, because it is largely uniform with regard to basically the higher your prevalence and incidence, the more border there's going to be if you're going to a lower prevalence country. There's not a really easy way to get around it. Like even though it's designed entirely pairwise, you're going to have to go through 2 quarantines. If you go to the intermediate level and then the other one, you're going to quarantine here and then a quarantine there. So you probably are going to just want to go directly and do 4 days rather than 2 days and 2 days. So it's not easy to get around, even though we didn't explicitly think through that or try to quantify that getting around the system approach. Where there are opportunities to do that is probably, but even then, I think it ends up working out. But, as I said, the population size of the country does matter. So you certainly wouldn't want to fly via Malta to Britain if you're trying to go there, right? Because you would have a big quarantine there that is not so dependent on such a big difference in prevalence, but is more because of the amount of tourist traffic to a country that has a small population.
Thank you. Yeah.
So that was a really interesting way to approach it. So a ton of questions. So one minor one is, I guess in Europe, there is both travel by planes, but there's also commuter kind of flows, right? Potentially that's just travel, but it's slightly different type. Do you take that into account?
We didn't. So we basically assumed air travel for our calculations, and that basically meant we could dismiss travel as a particular vector of transmission. I think, mathematically wouldn't be hard to incorporate if you have some estimate, if you have some way of saying, look, bus travel between A and B has this amount of extra risk, you could just throw that into the equations and it would not be hard. We didn't do it because we just wanted to focus on the question without having to have that additional content of modeling questioned in sort of a process. It's very hard if you do everything. But yeah, I do think that's a really relevant point, especially for bus travel, train travel to a certain extent as well.
This might be an interesting design question. So this is like cohorting. So some countries had like arrangements with each other that their citizens could come. So you could imagine in the strategy space that you are like coming out, you could have maybe like a two-level hierarchy. So within one group, there is one type of decision coming in, and then maybe with more lax. So like stricter border controls to come into that group, and then within that group, a little bit less. Does that make sense here in the setup you have, or?
I hope I understood your question correctly. If I did, that is exactly what we were advising, right? I'm not sure. Do you mean groups of countries that?
Yeah. So let's say Spain and its neighbor have maybe higher.
So the way I showed it was on a country by country basis. But in fact, Europe had, as I mentioned, this sort of traffic light system, which said, these countries are hotspots and these countries are less hotspots. And so it was grouped in the way that you're describing. And we have a translation of this to that particular policy structure in the paper that I didn't go through in detail, because as I said, it's very dependent on the particular policy structure they had imposed in Europe. And I actually don't think it was an advisable policy structure, but it was the policy structure. So it made sense to sort of talk through that. The reason it wasn't advisable is that what it basically was doing was pointing out which countries were problematic, but it wasn't dealing with the destination country, right? So if you're Hungary and you've got Poland with very high levels as well, you don't really care that Poland has high levels because you have high levels, right? So, and it didn't deal with the destination at all. Their policy structure was entirely about the origin country. And that's that's just bad policy. That's not how you should set it up, because it matters what your destination is. So we did adapt it to that. So, knowing that is the policy structure you have, what can you take from this mathematics and we did have a way of doing that. And similarly, you could certainly come up with blocks of countries and say, look, here's a block, here's a block, here's a block. And from this block to some other block, we'll impose this. And that might simplify a lot of the policy determination, as opposed to having like every country having their own distinct policy with distinct quarantines from every country to every other country. Being a quantitative person, I'm all in favor of quite sophisticated policies like that, but I know they're very hard to implement in practice.
Thanks.
I want to thank everybody for coming, and especially thanks to Jeff for a great talk today. Resume back in June, so hope to see everybody then.
Thank you. Thanks so much, Jeff. Excellent.
Bye, all. Thanks so much for your careful attention and comment.
Bye.
Bye, everyone.